Hi, I'm Pia.
And I'm Katina.
We are with Newport Beach Trauma Therapy, and today we wanted to give you an opportunity to see what a first session would be like with either one of us or our other clinicians at Newport Beach Trauma Therapy. Katina, what can somebody anticipate when they come for the first time, either in the office or they schedule via Zoom? Because we all get a little bit scared, let's face it. I know I would be if I hadn't been in therapy at all, or it's been quite some time that I had seen a clinician. So how do you address someone who comes in who's feeling a little bit scared?
That's a great question. And you're right. It can be scary. It can feel very, very new, very uncertain, depending on what a person's history is. Essentially, when you make an appointment to come see one of us, it is our goal to create a warm and inviting and safe environment for you. We stay laser focused on your uniqueness, tailoring our approach to what resonates with you, what feels safe for you. And I think that, one of the things that Pia and I were talking about as we were preparing for this video is, what might a person that calls be wondering, or what might they be feeling a little bit of anxiety about when they think about, I'm going to schedule this appointment. What's going to happen? What can I expect?
Yes.
And I think that one of the things that we both agree that we really want you to know is that when you call to come see one of us, you will not be required to talk about anything that you're not ready to talk about. Now, keeping that in mind, I know one of the things that I like to do, and I believe, Pia, you operate the same way, is, we stay very mindful of when you call to come in. We're very attuned to the fact that people tend to make that phone call when they've got something to talk about right now. So I don't like to spend a lot of time asking little interviewee kind of, intakey questions. There's a lot of that gets filled out on your questionnaire before you come in. And I like to get right to what's feeling present for you, what's getting in the way of you getting more of what you want for your life, and so that we can begin to build a roadmap to get you there.
I love that. I absolutely love that. And I think the other part to add on to what Katina just mentioned, besides creating that roadmap, which is so essential to understanding the direction that we're going into the healing process, we definitely want to create that space of safety, that space that you will feel welcome and you'll feel that we are there for you 100%. This is about your journey, and we are here to support that journey in whatever direction it ends up going. There isn't a particular style, modality. I have had a lot of clients come in and go, "What modality do you use?" And I love that question, because somehow we have given the message as clinicians that there's a particular modality, and it's not a one-size-fits-all. We have to be able to attune ourselves to whatever your needs are, but also leave ourselves open to understanding you and the direction that you're willing to go in. So I think overall, the first session is really connecting with you and finding out what's most important for you during that first session. And we can go from there.